You down with HPV?
Hell no, not me.
Nah. MJ, are you down with HPV?
Hell no, not me.
Hell yeah, loving it, bro. Hell no, nobody should be down with HPV. Absolutely not. And that's our topic today.
But if
MJ.
you do, we're gonna let you know what to do.
Yeah, exactly. Just come see us. We'll help you out. So
that's our topic today, right? STDs. We've gotten a lot of requests on this. Let's jump into it, bro.
Yeah. So welcome back, everybody. Today we are going to be talking about STDs, the most common, what to do, what not to do, who you should talk to, and of course signs, symptoms, and etc. Yada yada yada, all that good stuff. But the first thing and most common thing is, I think we need to talk about the most common ones, MJ.
Yep.
Talk about the treatment and stuff like that. So. I think in our population, of course, it's less prevalent because we have an older, more geriatric population.
I don't know, man.
Not that it's not seen.
I'm just saying, I had a patient that went through, like, he was in a nursing home and he just went through every room and he just passed on the same STD to every woman.
Well, I mean,
and I was treating a lot of this. I'm not joking. Like in nursing homes, it's huge.
Yeah, but compared to like 15 to 24-year-olds, just that we can't.
They're not as sexually active.
It's not as sexually
unless
active.
You get that
exactly.
one. I'm not saying he's a stud, but I'm just saying like that one guy that still has a sex drive. Not saying that the stud is passing STD. I'm saying he still has a sex drive.
Yeah, but you've seen studs, but I've had some female patients as well that have a lot of issues because they've been, young sailors. Yeah. You could call it young sailors if you know what I'm saying. But anyway, so I think, let's go.
Jump into it,
let's talk through it. Sexually transmitted diseases versus sexually transmitted infections. They're the same thing realistically, but the difference is if you have the disease, you actually have the symptom.
Yep.
The infection, you could have bacterial vaginosis, but you might not have symptoms. So that's the actual infection. But
there's some people that don't even get, like, I had somebody was the same partner for 20 years and found out he had herpes 20 years later.
Yeah,
and he swears up and down that he never had sex. I mean, there's sometimes that you don't even get any symptoms for that long.
Well, they say that 1 out of every 4 people in the United States have herpes, but they don't know about it.
20 million sexually transmitted infections in the U.S. per 2022.
It's kind of crazy.
It's
kind of crazy. I
What's
think
the
this
most
country
common?
loves to have sex.
What's the most common?
HPV.
And what's the reason that it's controlled?
Because of the vaccine.
Exactly.
Because
before the vaccine,
it wasn't. And the complications are typically genital warts or cancer, and that's the scary part.
Yeah, you gotta be careful. That's why people have to get the pap smears and do all that stuff.
Absolutely. So, but let's talk about like the bacterial types, right? In general, just types of bacteria. You'll have bacterial vaginosis, you have chlamydia, you have gonorrhea, and syphilis.
Oh man.
Right. So, I think a very common one is bacterial vaginosis. It's probably one of the most common that's actually active. We probably don't see it in our...
What are some symptoms? So like dysuria, urinary frequency, your discharge,
vaginal discharge,
painful ejaculation.
Yeah, exactly. But see, so the discharge, right? Sometimes it's like a thin white, like milkish type discharge, or even a grayish type discharge, which is pretty greenish as well.
I've seen a lot of that.
So what do they do to test it? How do you test for that? They call it something called a whiff test.
Yeah.
If you ever heard of a whiff test, right? so some of them will do a whiff.
Not fair to us, man.
It's like, hey, let's check that out for you.
Yeah.
Oh, that's
it's like
BB.
If you do that and you do a face, you have it.
100%. When you start tearing up, you're like,
you do it.
Woo! Woo! So we could also add like potassium hydroxide to kind of exacerbate that whiff test to kind of help it out a little bit for us to test it. But typically, those are the symptoms. And the treatment options are typically metronidazole. 500 milligrams twice a day, 7 days. If you cannot use
make sure you don't drink alcohol with that.
Well, of course.
If you're on that, guys, do not drink alcohol.
You've got to be very careful.
You'll find out the hard way.
If you don't tolerate metronidazole, you could also use clindamycin cream, 2% typically. One applicator intravaginally at bedtime for 7 days. What else? So we could talk about, we talked about bacterial vaginosis, right? Another one. Chlamydia. What can you tell me about chlamydia? It's very common. Absolutely. Typically in women under 25 years old, I mean, they get a lot. Or if you're over 25, it's usually with multiple sex partners.
It's so common. Like, I think here's one thing I want people to understand. If you do have this, don't be embarrassed to get treated because it's so much worse that you don't get it treated.
Absolutely.
The complications of not getting treated is the problem.
Yeah.
Like, it's common, guys. I'm not saying be smart about it.
Of course.
Use condoms. Know your partner. But if you do get it, you had a night out, you had a couple drinks, you ended up with a partner, you got it. get it treated, and
Yep.
you know, you would usually use doxycycline and azithromycin, right?
Yeah,
Either
typically.
one.
And
Either
you
one.
also got to treat the partner as well. With this
Always.
one.
That's another thing.
With bacterial vaginosis, you don't have to.
And so don't hide it from your partner.
Yeah.
Well, how do you talk to your partner about like if somebody, because I've had patients tell me like, hey, I got chlamydia, I don't know what to tell my wife. I'm like, you're gonna get it again.
You need to
know,
tell
like
her.
you're gonna treat it. She still has it. You're gonna have sex, and you're still gonna get it.
The scary part here is that in our younger generation, especially for women who want to get pregnant as well, this is a very important thing that you need to treat.
Good point.
Because it increases your risk of pelvic inflammatory diseases like infertility, etc.
Oh my God.
So
Infertility is
huge
because of that.
Causes a lot of complications. So this is something that has to be treated. Do not wait on it. Do not be ashamed of it. Treat it. Fix it. So
and we can, and there's some other ones like HIV and syphilis is just so in depth. And believe it or not, when I was at LSU, I think Baton Rouge and Louisiana was top 3 of the most HIV in the country.
Really?
In the country per capita.
Wow.
And so we saw so much. And to be honest with you, one of the saddest things that I ever experienced is that the people that have HIV and people judge them or mistreat them or don't want to hug them.
Look at them different. Yep.
I had a patient, right? How common is it, right? They deliver the baby gets HIV.
Oh.
Baby never, like, she grows up, she's never had sex, she's never done any of that. She didn't cause that.
That is so sad.
And then they judge her, they don't want to hug her. It's like, guys, you cannot, if somebody has HIV, you're not going to get it by hugging them.
Yeah.
Like, that's not how it is. It's a blood,
Yeah.
like,
Or
you pass it on through blood, right?
Exactly.
Now, there are some people, I always say, mothers, if you have it, don't chew your food and feed your child.
Yeah.
Because that's another child's. Like, if you have like an opening in your mouth and you're bleeding and you chew the food and you feed your child, you can also give it to your child that way. So you got to be very careful, but just don't treat them differently, man. They're humans. There's people back in the day in the medical field that were, get it by needle sticks.
Yep.
There's so many ways that you can get it. You kiss somebody with an opening in their mouth and they're bleeding. Like, there's so many ways. Don't judge them, okay? Like, as much as we joke about this, I've had so many talks with patients and it's so sad. Don't judge them. You don't know what they've been through. You don't know how they got it. Be nice. You're not going to get it by shaking and hugging. Like, let's calm down,
I agree.
And again,
and
there's kids
that's
that
why
get it.
you need to educate. We need to educate our patients.
That's what we're trying to do
in general about this, for sure. What about gonorrhea?
Still, we kind of talked about gonorrhea a little bit.
Talk about chlamydia.
Okay.
Yeah, but gonorrhea, also kind of the same thing. Sexually active patients, 25 years typically. If it can happen in older patients as well, but with more sexual partners typically. And I don't know how much I have to emphasize on a lot of this. We're also talking about like vaginally, sex vaginally, orally, rectally. You have to be extremely careful with this.
The reason with rectal, guys, that you guys got to understand, that rectal area is one of the most vascular areas in your body.
Yeah.
So the reason that sometimes they don't want you to do, rectal sex or whatever
anal,
it is, anal sex, is that because of that area is so vascular, it's more likely that you can pass on
for sure
the disease. So
for sure.
They do talk about that a lot also.
So if the treatment options with that would be Rocephin or ceftriaxone. Typically, if
we're talking about gonorrhea.
Yeah. So 150. So it's 500 milligrams IM for patients under 150 kilos. If it's over 150 kilos, you'll give 1 gram typically.
And if you have an allergy to it, talk to your primary care. They'll find an alternative.
You can use Doxy.
There's a lot of other ways you can
they treat. So I'm sorry. So they don't treat it with Doxy. Typically, they'll add Doxy if they think there might be a chlamydia infection as well. You see what I'm saying? So they kind of try to cover both.
Because they are sometimes, you usually end up getting both sometimes.
Exactly.
Right?
Exactly. So that's why I kind of treat both.
And you should also follow up after.
Yeah, well, you have to
sure
test again. And then a lot of these patients, if you've had it, I would recommend testing every year.
Yeah.
Especially if you're sexually active and if you've had it, get tested every year.
Yeah. If you're a male and you have discharge from your penis, you have pain when you ejaculate, all of these things definitely get tested also.
Yeah,
because you don't want to pass it
to
your wife or girlfriend and then they can't get pregnant. There's so much complications. That's why we emphasize so much. Get it treated, guys.
Yeah,
don't hide from this because it's going to affect you long term.
For sure. Another one which a lot of people don't know about is hepatitis, right? Like hepatitis it's pretty common. I mean, hepatitis
it's
A,
just
hepatitis
treatment
B,
is so much
hepatitis
better
C.
now. That's what it is. Even for HIV, there's more of a chance of you dying from diabetes than you are from HIV, right?
For sure. But the problem here, it's a lot of it is supportive care, right?
Yeah.
With hepatitis, especially like hepatitis A, right? Yeah, you can get the vaccine.
Exactly,
hepatitis A usually comes like the fecal oral route, bad water, bad food, etc. So you got to be careful. But a lot of that is supportive care, but it's very curable and treatable. Hepatitis B, of course, is a little bit more kind of sex and bloodborne, I would say. And hepatitis C, of course, is also more bloodborne. bloodborne. So,
And
but
that's why that certain years that if you were born in those years, you got to get tested because of transfusions.
yeah,
They
the
weren't
1967. I think it was 1967. Yeah.
check on that. But yes,
Yeah, we'll check on that.
And so like if you were born between those years, then you should
Before
always be
that.
checked for hepatitis C because you could have gotten a transfusion and got hepatitis C and not even know it.
Yeah,
And it
for
can
sure.
affect your liver and stuff like that. So you just got to be very careful with that.
Absolutely.
And with hepatitis, it can get very dangerous. So I would definitely, I test a lot of my older patients.
Mm-hmm.
Again, the transfusions was a big thing back in the day. And there's good treatments for it now. I mean, they were very expensive.
Yeah, they are. They are.
getting
But
very
of
expensive.
course, you know, and a lot of them remember these. Once you have hepatitis, I mean, typically hepatitis B or hepatitis C, you have it,
Yeah.
and it's chronically. Now, of course, it doesn't have to be active, right? You'll have it chronically. It's controlled. So as long as your symptoms are controlled, you should be fine.
The same thing like herpes. Once you got it, you got it.
You got it. It lives. It lives.
And that's why it's so painful. It's at the end of the nerve root.
Yep.
So that when it's active, it activates that pain from that nerve.
Oh,
And then you get the
disaster.
active lesions and it causes such horrible pain. But you can go 20 years and that virus is at the end of the nerve and it never gets activated until your immune system drops or whatever it is. And then boom, you get some lesions.
absolutely.
Get that treated, guys, also because
Oh yeah.
just-
And don't wait, right? A lot
No,
of them
don't
wait.
wait.
Let's control
Oh,
it
man,
quickly.
the pain is
Antivirals, you know,
horrible.
acyclovir, valcyclovir, whatever it is, just talk to your doctor quick and get it done because it's all about that viral replication. You control the viral replication, then you control your symptoms.
100%.
You know?
100%.
So and then of course syphilis. That's one that I don't think is as common as. But I mean, actually, they said that the problems has increased a lot in the last couple of years. But we treat syphilis with a long-acting penicillin G, benzathine penicillin G. Pregnant women have to make sure that they get tested for syphilis, typically in the first trimester and also in the third trimester. If you are thinking about being pregnant or you are pregnant, you need to be tested for syphilis. But yeah, so okay, one more recommendation,
Yes, sir.
MJ, that I'm going to give is please, if you are having sex, use protection, use a condom. And when I say use a condom, I'm going to say this very loud and clear. Use it the right way.
Yes.
You see what I'm saying?
And you're not using it to prevent just pregnancy.
Exactly,
Guys. It's like,
exactly.
oh, I'm not worried. She has an
she-
IUD. She's
oh, yeah.
on birth control. No,
No,
guys,
no,
we're
no,
trying
she
to
can
prevent
still-
the STDs. Like that's what
Exactly.
we're really worried about. here.
Exactly. So, and so
That's
yes,
it.
I am not down with HPV. Are you down with HPV?
Absolutely not, my man.
Don't be like, absolutely not me.
Absolutely not me. I can't rhyme.
So
bro.
MJ cannot rhyme, yeah. So
I'm sorry.
kinda
Your
figured
phone
that out.
rings. I can't rhyme. It's
So you're gonna use that the whole
hand-to-hand.
time?
Oh, 100% until
Really?
the end of the day.
Really?
Every recording, and I'm gonna
Okay.
let everybody in the comments also make
What's
fun
the
of
P for on your hat?
you. P?
Yeah.
HPV.
Really? Also, so you're proud of it, right? All right, guys. That was fun.